Okay, everybody, we are going to finish up medical terms by body systems, and then we are going to pick up with medical abbreviations. Um, so we stopped with a little bit of clinical. Um, we stopped back one previous slide where we did some clinical exercises. So now we're going to move on to some more diagnostic information. Give it just a second to load. I'm sorry. Okay, so endoscopy, it's how we can visually examine organs or cavities. We use something called an endoscope. Endo means inside, scopy means to scope. So it could be where we take it has a camera on a light on the end and feed it down through the throat. And we can see the stomach. We can see part of the intestines. So what you're seeing there is a gastroscope, but there's also a colonoscope, which goes up through the colon, through the rectum into the colon, where you can see what's going on. If there's anything in there that shouldn't be there, there's the ability to cut, remove, and cauterize. It can be they can remove polyps. They can, if someone has bleeding ulcers in the stomach, they could go in and they could cauterize that. They could take a biopsy of it and be able to kind of see and determine what's causing that. They can aspirate fluid from areas just to kind of determine what's going on with that. Radiography, radio is that's what we consider our radiology or our X-ray procedure in the hospital. What you see there on the right is a chest X-ray, and it's the use of electromagnetic beams or radioactive beams that pass through the body and produce an image. Sometimes we use radio opaque dyes like an iodine-based dye so that we can see the soft tissues. We use those a lot with CTs and MRIs. Also, with fluoroscopy, sometimes we use something called a barium enema. We have people drink barium, or we insert barium through the rectum so that we can look and see what's going on in the colon. If you look at this image on the right, the dark shade under the ribs, you can see the collarbone or the clavicle. You can see the rings of the trach up there at the very top. You can see the dark spaces that are the lungs. You can see a little bit of the diaphragm. You can see the heart there in the center. And then the dark spot that you see there on the bottom right part, that would be stool or bowel movement. So we can see a whole lot in a chest x-ray related to the size of the heart, the lung function, all that kind of stuff. Ultrasound, that's where we pass high frequency sound waves through a transducer or through a probe that produces an image of the body structures on a computer screen. So, we have the ultrasound device, and there are multiple different types of transducers. Some are used for external, some are internal use. And what we can see like in a gallbladder, if we were doing an ultrasound of a gallbladder, we could see if there were solid particles in there. We can see, and we can do an ultrasound of a breast to see if there's a tumor or fibrous area in there. We can even look in some of the lymph nodes and see if there are abnormal cells. Ultrasound, that they're, like I said, they have that handheld ultrasound transducer that can look at the bladder to see if it's full of urine, to see if there's we use them a whole lot for obstetrics, where we see how the baby's growing, how the placenta is, how the amniotic fluid is growing, making sure everything is progressing appropriately. Sometimes we have to use internal probes very early on in pregnancy, or for other lower abdominal masses. Sometimes we have to use an internal probe. Ultrasound or sound waves from the transducer of the probe are reflected off of an internal structure, and it makes kind of echoes. Those echoes are then changed into electrical symbols, and they're analyzed by the computer, and then that's how we see that image. The brightest areas in the ultrasound are where we see the strongest echo. So think about if the bladder is empty, it's going to be collapsed and kind of solidified. But if it's starting to fill up, we'll be able to see more. When the baby's about 18 to 20 weeks old, we can start to see that heart start to flutter, so we can see that solid particle or that solid mass where it's bouncing off, and we can see that movement of the heart. A PET scan or a positron emission tomography, a PET scan. It uses radioactive chemicals called tracers that are introduced into the body, usually via IV, through an IV catheter, and they accumulate in an area that has rapidly metabolizing cells. So this is a really good way for us to detect cancer cell growth. It's a way for us to see if things are in remission or if they are progressing. It's one of our best ways to look at cancer growth, or if we have slowed or stopped cancer growth. And what you're seeing there is metabolic activity of brain tissue. So we can do PET scans of the brain and see, how cells are reacting as well. A PET scan is positively charged particles or protons or positrons are emitted in the body region and detected by a device called a gamma camera, and it produces the image. So the gamma camera, some of you may have who've had family members who've fallen and broken a hip may have heard of gamma nailing. They use gamma knives in certain kinds of surgeries, but for a PET scan, we use a gamma camera. It defines areas of high metabolism and decreased metabolic activity. Increased metabolic activity could possibly be a tumor, and decreased metabolic activity, especially in the brain, can detect Alzheimer's, Parkinson's disease, epilepsy, some other neurological disorders. An MRI, or a magnetic resonance imaging, is the use of radio waves and strong magnets to produce a multiplanar cross-section of images. So when we talked earlier about the frontal plane or the coronal plane, the mid-sagittal plane, and the transverse plane, what you're looking here on the right is a mid-sagittal image of the brain, of the skull, of the cranium. So you're seeing the midbrain, the cerebellum at the back, the frontal lobe, all of the cerebrum. So you're seeing the pons and the medulla, all the parts of the brain there in a cross section or in a mid-sagittal plane. So it does cross sections or sectional images of the brain or of the body when you have an MRI. A lot of you, if you've had ACL injury or MCL injury, or you've had injury related to maybe you've had people who've had back injuries, they get a very good image, as you can see there on the right, as compared to that compared to those x-rays and the ultrasound that you saw. So now we're going to use some words compared to that. So a record of sound would be a sonogram. So sono meaning sound, and then gram means record, sonogram. A process of recording images using frequencies beyond sound would be ultrasonography. That would be our ultrasound. Instruments that cut into the skin would be a dermatome, or dermatome, dermatomy. Instruments that examine the bronchi would be a bronchoscope. So scope means a camera that goes down. The bronchus or the bronchi, which are the go into the lungs, and they can do bronchoscopies where they can either remove fluid, look at what's going on in the lungs, kind of sometimes even inflate the lungs with a bronchoscopy. Instruments that measure the cranium. So we already talked about a craniometer. Endoscopy would be a scope that goes inside the body, either through the mouth or through the rectum. Transabdominal would be imaging that sees through the cross section through the center of the abdomen. The study of blood would be hematology. Hemato means blood, and ology means study of. Instrument measuring the heart, measuring heat. Sorry, that would be a thermometer. Thermo means heat. Meter means to measure, so thermometer. Specialist who studies in X-rays, or a radiologist studies all radiological imaging. Okay, so we're going to stop there with some of the medical word exercises, and I'm going to switch over and we're going to talk about common symbols that are abbreviations that are used in medicine. And I will upload all of these slides for you. So medical abbreviations, when we talk about medical abbreviations, there are some that we do and we don't use. And as we go through here, we'll talk about ones that maybe are not used as often anymore. So medical abbreviations are used by medical personnel, either written or orally, to save time, basically, and save space on forms, or save space in charting, to help cut down on the amount of actual pieces of paper. Abbreviations are immediately observed. We should know them. They should make sense to us as medical personnel, and they should not be confusing to others, which means when we use medical abbreviations, they should be abbreviations that are used by every part of healthcare. It shouldn't be something we abbreviate ourselves. Another thing you should know is medical abbreviations, every facility you work at, whether it is a hospital, a doctor's office, a home health agency, a physical therapy clinic, no matter where it is, they will have an approved set of abbreviations. When you are documenting, that approved set of abbreviations are the only ones you use. We may learn a ton of abbreviations here, but a place you go to work may only allow a certain number of those. And in that instance, we don't use them, even though we know that they're medical abbreviations. If they're not approved by your facility, you just don't use them. Because when your charts are audited, if they're audited by Medicare, or you have to go to court, the court will ask for your facility's approved medical abbreviation list. And if you use things that aren't approved, then that is on you. So be sure that you know and you get a copy of what your approved medication list, your approved abbreviation list is when you go to work for a medical facility. Using incorrect abbreviations can result in serious problems for the patient and serious problems for other healthcare professionals, as well as insurance record processing. We can't bill for things that we can't understand what was done. And so if you use medical abbreviations incorrectly, someone can get the wrong medication, they could get the wrong procedure, or we can't bill for it because it doesn't match the disease process or the coding. If you're ever concerned about an abbreviation, don't use it. Just spell it out. Use the word instead. And never, ever, once again, never use your own abbreviations. You only use the ones that are medically approved and the ones that are approved by your facility. Like I said, each hospital and clinic has its own acceptable abbreviations. Be sure you learn that list. Request it when you go to work there. If they tell you you don't have one, I would suggest don't use abbreviations. If there's a set that's approved by a floor but not by the facility, I still would be cautious about using them. So these are some common abbreviations that may or may not be used by your facility. A capital A can stand for assessment. Not many facilities use a capital A for assessment, but they will use A with a line over it to mean before. AC meaning before meals. ADLs, all caps, would mean activities of daily living. Activities of daily living would mean like bathing, dressing, brushing your teeth, oral hygiene, tying your shoes, putting on your shirt. Those are all activities of daily living. Ad lib means as desired, not used as much anymore. AIDS, acquired immunodeficiency syndrome, still used. AM, either capital or small. Generally, you'll see it as all caps would be between midnight and noon. AMB as ambulator, ambulatory. AMB is used quite a bit because it may be AMB slash AC, which would mean ambulate before meals. AMT, amount, used mostly with medications and pharmacy, not so much on your general floor because we use percentages related to, we'll say breakfast 50%, lunch 50%, dinner 50%, and then we use the exact amount of ounces or milliliters or cc's of fluid that are taken in. Same thing with number. We'll use number or number of stools or bowel movements, and then we would use the actual volume number, cc's or milliliters of urine. AP is anterior position, used a lot in radiology, or if we're doing stuff related to certain positioning for examinations. ASA is still used often for aspirin. ASAP, we don't use that as much as we used to. We would use STAT instead, which means right now or as soon as available. Atrioventricular, AV, the AV node, we use that a lot. AX for axillary sometimes is used for temperature. We try our best not to take an axillary temp unless it's a small child, and the doctor specifically orders axillary temps. But I would suggest writing axillary out. AX could, if you're handwriting it, or if could be misinterpreted. B for bilateral. BIL sometimes is used for bilateral. Once again, bilateral is something I suggest spelling out because there can be multiple abbreviations for bilateral, and things that there are multiple abbreviations for, I definitely suggest just writing it out. You're better off. You're less likely to make errors. BID is twice a day. It's one that Joint Commission has kind of recommended us not to use, but doctors still do. We don't use BM anymore for bowel movement. Doctors still do. Other medical staff don't. We tend to write that out as stool or bowel movement. BP for blood pressure. We do use capital BP for blood pressure. We don't really use BS for blood sugar because some people write that for bowel sounds. So it can be used like or breast sound. So it can be used for multiple things. So we really don't use BS anymore. We may do FSBS for fasting blood sugar. But normally we will write out breast sounds, bowel sounds, or blood sugar because it can be too many different things and it can be confusing. So when they mean more than one thing, I would use caution and just write that out. Biopsy is BX. C with a line over it. Small c with a line over it means with. Capital C is Celsius, and usually it will have a little degree symbol before it, so degrees Celsius. CA we use for cancer. CBC means complete blood count. Capital CC is chief complaint. Small cc is cubic centimeter. We really don't use cubic centimeter much anymore. We use milliliters instead because 1 cubic centimeter is the same as 1 milliliter. So we use milliliters more often than not than cc now. Congestive heart failure, CHF, capital CHF. Yes, we do use that. Small cm for centimeter. CNS for central nervous system. We do use that. C/O, complains of, we use that. CO2 for carbon dioxide. COPD for chronic obstructive pulmonary disease. CPR for cardiopulmonary resuscitation. Most of you have learned that, or you will learn it this year. CSF for cerebrospinal fluid. CT for CT scan or computer tomography. Remember, any of these are eligible for testing, so be sure that you're making flashcards. You're going over, you're learning what these words mean, what these abbreviations mean. CVA for cerebrovascular accident or a stroke. It means the same thing as stroke. CXR is what's used for chest x-ray. A small d for day, we may use QD for Q means every, so QD would be every day. Capital D/C is what we use for discontinue. We don't use a little dc or just dc by itself. D/C is most often used. DM for diabetes mellitus. We use IDDM for insulin-dependent diabetes mellitus. DNR means do not resuscitate, often used. DOA means dead on arrival. DOB is date of birth. DRG is diagnosis related to group. DRG is related to our payment for is related to payment for work that we do in the healthcare field. DVT is deep vein thrombosis, also known as a blood clot, generally in the groin or lower leg. DX, we use that for diagnosis. EKG or ECG, we both use for an electrocardiogram, which is that tracing of the heart. EEG is electroencephalogram, which is being able to do a tracing of the electrical conductivity of the brain. EMG, electromyogram, we don't use that as much. We just usually write out electromyogram, and that's the muscle activity, a graph of the muscle activity. ENT, ear, nose, and throat. We do still use ENT some. ER it can also be used as ED for emergency room or emergency department. ETA is estimated time of arrival. ETOH is what we refer to for alcohol. If we do an ETOH level on someone, that's a blood alcohol level. F with a little degree symbol would be degrees Fahrenheit. FSB would be fasting blood sugar, or FSBS. Both can be used for fasting blood sugar. FUO means fever of unknown origin. We use that some. Doctors use it often for fever of unknown origin. FX with a little f or a big F, both can mean fracture. For gram, we generally use G. G for gram, but can also be GM. And when we do medical math, you'll see that. GERD, GERD, or we refer to as GERD, which is gastrointestinal reflux disease, or as you guys consider it sometimes, heartburn or reflux. GI is gastrointestinal. GTT or GTTS means drops. When it's little. Capital GTT is glucose tolerance test. I generally will write out glucose tolerance test because we do use, especially with IV fluids or medications for children in the liquid, we use little GTT or GTTS for drops. GU means urinary. GYN means gynecology. H stands for hour. So if something was QH, it would mean every hour. HA, we generally, and as healthcare providers, don't refer to headache as HA anymore. We will write out headache. HBV, hepatitis B virus. HCT for hematocrit, goes along with your HGB, which is your hemoglobin. HEENT, which means head, eyes, ears, nose, and throat. You will see HEENT when it talks about assessment, on an assessment. That will be the assessment heading, where you're basically assessing the whole head, the eyes, the ears, the nose, the throat. You're asking questions about there. HG is mercury. And we measure blood pressure in millimeters mm/Hg, which is millimeters of mercury. H2O we use as water. H2O2 is hydrogen peroxide. Normally we just write out hydrogen peroxide. We don't use H2O2. HIB, which would be the Haemophilus influenza B. So children have a Hib vaccine, and you will see that often when they get their Hib vaccine. HIV for human immunodeficiency virus. H&P is generally what's used for history and physical. Very rarely have I seen HXPX. Usually it's H&P. The doctor will ask you for the previous H&P on the patient. That would be history and physical. HR for heart rate. HS is for bedtime. Usually we write out height instead of HT. It's not widely used anymore. HX for history. We do use that, will be medical HX, or like use HX of diseases or HX of disorders. ICU for intensive care. IDDM, which I talked about earlier, which is insulin dependent diabetes mellitus. IND, which is incision and draining. If someone has a boil, or they have a red raised area or a pustule, we will do an IND on that, which is incision and draining. INO means intake and output. Inpatient, we just write inpatient out. Occasionally, it will be written as IP, but most of the time we just write it as inpatient because it's much, it's easy to be, because there's something called an IVP, which is which is a procedure for the kidneys, and so we generally don't write IP. IV we still use for intravenous, like IV fluids, IV push for something that you give quickly into the vein. Potassium is usually written as a K. Kilogram is kg. You guys should know that. Left will be as L, capital L. Right will be as a capital R. Liter, we usually write as a small L. So like milliliters, we might write that a patient's getting 3 liters of oxygen, 3 liters of O2 via NC, which means nasal cannula. O2 is oxygen. For pounds, we really just write LB. We don't use the hashtag because most people your age don't know that that is the pound symbol. So we use LB, or we write out pounds, or LBS. LND stands for labor and delivery. LLQ, all caps, is the left lower quadrant of the abdomen. We talked about that in our previous slides. LMP stands for last menstrual period. You will see that often. We have to ask females basically between the age now of around 10 to 60 if they currently have a menstrual period, and if so, when did they have their last menstrual period. LOC, we use that for level of consciousness, not loss of consciousness. Loss of consciousness needs to be spelled out because it needs to have specific time frames, and it needs to kind of be highlighted a little more. LOC for us means level of consciousness. Leftover upper quadrant, we talked about that one already. Milligrams is mg. We don't really use it as an m because that could be mistaken for meters. So milligram we write as mg. Myocardial infarction would be a capital M, a capital I. And we have to make sure it's capital because if they were little, it might be mistaken for milliliter. And milliliter is ml. Millimeter is 2 small m's. I don't know why that one has a capital, but it's written as 2 small m's. MRI, magnetic resonance imaging. We've talked about that one already. Na, so that's what we refer to sodium as Na. And so if we had a patient that had hyponatremia, they would have low sodium in the blood. So we use Na, and like hypokalemia would be a low potassium in the blood. Na is not applicable. We write out newborn for the most part unless you specifically are working in an area where there is only the nursery. If you were just working in the nursery or the NICU, you might use NB, but most of the time we just write out newborn. NCR, no cardiac resuscitation. So if someone has a DNR that is but they have an advanced directive and they wish to have chemicals given, like epinephrine or atropine or things like that. They may have no cardiac resuscitation, which means they want no active, no mechanical CPR. You may can give them medications, but no mechanical CPR. Negative, you can write NEG, but most of the time now we write out negative. We just write negative. NKA or NKDA, no known allergies. And the difference in that is no known allergies means they have no food, no drug, and no contact allergies like latex or things. If we put NKDA, that means there's no drug allergies. Don't drug allergies mean they may still have food allergies. They may have a latex allergy like that, but that would be no known allergies means they're not allergic to anything. No foods, no liquids, not adhesive, not latex, but no known drug allergies means they're just not allergic to any type of medication. Knocked means night, so nocturia would mean that the person gets up at night and goes to the bathroom. NPO, we always write that in caps, means nothing by mouth. And when we say nothing by mouth, we mean no liquids, no food, no nothing by mouth. No medications, they all have to be given IV. NS stands for normal saline. N and V is nausea, vomiting. O2, we still write as oxygen as O2. OA is osteoarthritis. OB, we write it in caps for obstetrics. OD can mean over. We don't use OD for right eye anymore. It's better to write out right eye, and then unless you work in the ear, nose, and throat clinic or for an obstetrician, OD for the most part in charting means overdose. Ointment can be abbreviated as OINT, OP for outpatient, OR for operating room, OS for left eye, OTC for over-the-counter medications. OU can mean both eyes. OV for office visit. OZ for ounces. P with a slash over it. So it would be a small p with a line over it means after. A capital P means pulse. PDR is a physician's desk reference. If a doctor asks you for the PDR, it's going to be a giant blue book, and it's full of medications and other things. PE for pulmonary embolism. We use PE for pulmonary embolism, not so much for physical exam anymore. PEDS for pediatrics. PER means by, for the most part, like we may use PER for a way we're going to administer something. PET scan would be that positronic emission tomography, which we talked about earlier. We don't use PK for painkiller anymore. We just don't use that one at all. Just forget that one's there. Capital PM for between noon and midnight. PMS for premenstrual syndrome. PO is by mouth. So if it's NPO, it means nothing by mouth. PRN, always in caps, as needed. Here's the thing with little pt you can use for patient. Don't use a capital P, little t, because it could be misinterpreted for physical therapy or pro time, which is a lab. So we use a small pt for patient. Q means every. QAM would be every morning. QD or Q day would be every day. QH or Q hour. And then Q2 hours would be every 2 hours. QH would be every hour. Q4 hours would be Q4H would be every 4 hours. Those are some examples of how you can use QH. QID would be 4 times a day. Once again, those are things that Joint Commission, if you work for a Joint Commission facility, they don't want you using BID, TID, QID, or QH. They just don't want you using those. We use capital R for respirations. If we're going to use capital R with a circle around it for right, we generally have it related to something else like right upper quadrant or something right lower extremity, RLE, right lower extremity, RUC, right upper extremity. It's not going to generally be by itself. RA for rheumatoid arthritis. RBC means red blood cell. or red blood cell count, but it really use RBC for red blood cells. REG is regular. RICE is rest, ice, compression, and elevation. RLQ is right lower quadrant. Once again, that right or that left, those R with a circle or L with a circle, they usually are in conjunction with something else. RO is usually the small R/O to rule out. We may admit someone to the hospital to RL/MI, rule out a myocardial infarction. ROM always means range of motion. ROS is review of system for the most part. Regular rate and rhythm, that's referring to the heart. RRR, we don't really use that a lot. We will write out regular rate, regular rhythm. RTC is only used in the clinic setting, which means return to the clinic. There's also a reticulocyte count, which is an RTC count. So we try not to use that one as much. Right upper quadrant is RUQ. Prescription is RX. S with a line over the top of it would be without. So C with a line over it is with. R with the line over it means without. SA means the sinoatrial node, which is part of the heart. SIDS, SIDS, is sudden infant death syndrome, generally only used in the pediatric clinic. SIGs is usually used with pharmacy. SIGs are instructions or directions. So if you're working in a doctor's office and you get something back from the pharmacy asking for a SIG, it means that there's no instructions on how to give that medication. Also, in electronic charting, they'll give some common SIGs that you can add to, like if they're ordering, say a doctor orders Caflex 500 milligrams. It may give you a list of common SIGs, which would be 1 QID, 2 BID, twice a day, and then you have to write the number of pills you want them to have. We don't usually use SM anymore for small. SO is standing order. We don't use standing orders anymore. That is just kind of frowned upon. So now we refer to SO as significant other. SOAP is a type of note. It is a subjective, objective assessment and a plan. A SOAP note is what a physician uses and some other healthcare providers. SOB stands for shortness of breath. Sub-Q is what we use most often. So for subcutaneous, like for our subcutaneous injection, a subcutaneous infection, we would use sub-Q. So that SUBQ is what we use the most often. We don't really use SNS anymore because it can mean too many things. So we write out signs and symptoms. STAT, we use STAT instead of ASAP now, except usually we write it in all caps, and that means immediately. STD, some people still use STD for sexually transmitted diseases. We also use STI for sexually transmitted infections. Temperature, capital T for temperature. Tab or tabs can mean tablets or tabs. Tablet or tablets. Capital TB for tuberculosis. TBSP for tablespoon. TCDB you will see often after surgery for turn, cough, and deep breathe. Temp we use for temperature more often than that capital T. TID means 3 times a day. TM you really only see that in the ear, nose, and throat clinic for tympanic membrane. We don't use that real often. TPR we really don't for temperature, pulse, and respiration. We try to steer away from that because we would rather write temp, pulse, and respiration, or RESPs, RESPS, as opposed to TPR because it can be misconstrued. TSP for teaspoon. TX means treatment. Capital U can stand for units, but it can also be misinterpreted for other letters, so we prefer that you write out units now. UA for urinalysis. UNK for unknown, so that fever of unknown origin. So that unknown would be UNK. URI, upper respiratory infection. UTI for urinary tract infection. UV we still use because sometimes we have UV therapy for patients with certain disorders, so ultraviolet light therapy. VA for visual acuity. VBAC for vaginal birth after a cesarean. Only going to use that generally with obstetrics. Occasionally, if they're having some type of gynecological procedure, but usually with OB the most. VS still stands for vital signs. We do not use VSS anymore. It is the last couple of years they have just gone away from using vital signs are stable, so we don't use VSS anymore. While awake, we write while awake, not WA anymore, while awake. WBCs are still used for white blood cells. Wheelchair, we write wheelchair out because it can also be misinterpreted because some people will consider WC something else, so we use wheelchair. We write out wheelchair. Week, WK. Within normal limits, we still use WNL. Weight, we can still use WT. Year of birth, YOB. Year can be YR. We can use greater than or less than symbols, the positive symbol, the negative symbol. We don't use the approximate symbol anymore, the little squiggle. We do not use that anymore because it can be, if it's not drawn really definitely, really defined, it could be construed as negative, so we don't use that anymore. Percent sign, we still use the percentage sign. We don't really use check marks so much in charting. We'll put an X in the box as opposed to a check mark because it may look like a slash instead of a check mark. Increase or the arrow up and the arrow down we can use for increase and decreasing. Left and right, the arrow's pointing left or right. Change is a triangle. We can use the @ symbol, the degree symbol, male and female symbols. Okay, guys, so now you have gone through most of the abbreviations that you would need to know. You've gone through a lot of the terms that you will need to know. I will give you a list of what you will be checked on, but just know that these common abbreviations and these common terms are things that we use every day in healthcare and we will use for the rest of the year. All right, everybody, you have a great day, and I will be back with you later. Thanks, everyone.